Good afternoon. My name is Kim Grady, and today I will be addressing mental health issues with Filipino Americans. The reason I chose this ethnicity is because in our state of Maryland, we have had a big influx of Filipino nurses and techs brought in to help reduce some of the nursing shortages we have across the state. My hospital, or one of the hospitals I work at in particular, has had about 40 to 50 Filipino medical workers brought in. And although they go through an extensive training to try to acclimate their nursing practice from the Philippines to the United States, there is some training that they don't go through that will affect their ability to work well in this new environment. And some of that is their cultural differences that they have, as well as their access to certain things that create a home environment for them, like the foods that they eat, some of the traditions that they have, the religion that they practice. If those things are not met, it can make it more difficult to adjust to this type of culture. Also, the fact that many of them are coming alone without their families is another barrier to adjustment that they have to experience. Luckily for us, the hospital that I work in, there is a large presence of Philippine nurses, and they have taken the ones that are coming in now under their wings to help them adjust not just to the work environment, but also to the environment that they experience at their new home. Some information that I found while researching more about Filipino presence in the United States is that according to the U.S. Census Bureau, in 2020 there were 4.2 million people classified as Filipino in America, making them the third largest Asian origin group in the country. Individuals of Filipino descent in the U.S. reported higher rates of perceived discrimination, thoughts of suicide, anxiety, and depression of all the Asian ethnic subgroups, yet they are the least likely to use mental health services. As mental health providers, it is very important that we understand the cultural values of the Filipino Americans. One such value is utanalo, or debt of gratitude. This is where high emphasis is placed on reciprocity and doing what is good for the collective. Many Filipino Americans feel indebted to their families back home, and for many of them, they are sending money, goods, and whatever they can to support their basic needs, their emotional and financial needs. Sense of duty can lead to stress and pressure to put family first, even at the expense of their own being. Another value is kapwa, or a sense of connectedness with one another. Kapwa can prevent someone from seeking therapy, especially if it involves going to an area such as a hospital or clinic where a family member or someone in their community works. The fear is the stigma that is placed on them based on the fact that mental health is seen as being quote unquote crazy. And what that does to the parents is that it makes them feel as if they have not done what was correct to raise their child right. So it puts a stigma on them to their community that they have failed as a parent to raise their child right. The third cultural value of the Filipino community I would like to address is pakikisama, or the ideal of social conformity. Pakikisama is the need to be accepted and for there to be peace and harmony amongst others. It is the promotion of group unity and social cohesion. Admitting to having a mental health disease or disorder can interrupt the peace and bring chaos. The fourth value is haya, which means shame or embarrassment. Now, haya seems like it's a negative value, but what it is that it's the mechanism to which Filipinos actively control and refine their actions and words to protect not only themselves but also others from embarrassment, like their family. By hiding their mental health disorders or their feelings of depression, anxiety, or suicide, they are protecting their family from the shame that is associated with having a mental health disorder. Other acts of shame that often get that create embarrassment for the family include not graduating college, or having a baby before marriage, or being older and not being married. Not only does it bring shame among the family, it also increases the stress anxiety, and depression amongst the person experiencing these things. Although the values that the Filipinos have are generally good and positive, and it's one of the reasons why the Filipinos have a strong sense of community, these same values might contribute to the nuances and the reasons why some Filipino Americans may have difficulty navigating the mental health issues. Just like many other ethnicities, there are barriers for Filipinos to mental health treatment. One such barrier is mental health literacy, and this relates to the challenges with understanding the process of finding mental health professionals, as well as understanding the diagnosis or any diagnosis of a mental health disorder does not equate to a person being crazy and should not result in that person being isolated or ostracized from their society or from their community. The second one is cultural mistrust. And cultural mistrust is brought from a presence of intergenerational trauma that other Filipinos have experienced in the hands of people that don't look like them or don't experience the same culture as them. Also, concern is for counselors of other ethnic groups would not fully understand or relate to or care about the cultural differences embedded in the experiences of the Filipinos. Religion also is a barrier because most of the Filipinos are predominantly Catholic, and Filipinos draw strength from the religious faith to endure difficult situations and challenges by leaving everything up to God. In many cases, the priest is the source of help instead of professional mental health providers. And that's something we have to think about when we are treating them, how these cultural differences may matter in the treatment that we provide, as well as understanding how they feel about that treatment. Another barrier for Filipinos to mental health treatment would be the logistical barriers. Let's talk first about the immigration status or fear of jeopardizing their status. Remember in the beginning when I talked about the group of nurses that came from the Philippines to the United States, to Maryland in particular, to help with the nursing shortage? Many of them may have come for the knowledge and the advancement and the opportunity to see the United States, but the majority of them came for the financial stability and financial growth that it could provide for their family back home. Many of them work overtime and work long hours in order to gain that financial status so that they can help their families back home. If they felt that their diagnosis or their seeking out mental health would compromise their immigration status, they definitely would not do it because they would not put their self before their family. Let's also talk about the lack of health insurance. Access to mental health can often weigh heavy when the person has to choose between the financial burden of family or the financial burden of health care for themselves. Just think about how much mental it is to get health care without health insurance. Many of them would choose their family over themselves at any time. Let's also talk about the language difficulties. Language difficulties can hinder effective communication as well as allow them to express their feelings or understand complex medical terminology. Even if we speak slowly or try to listen with intent and do active listening, sometimes there is still a barrier where they don't understand, but they may say that they understand. This does not help them to get the kind of care that we would like to give, where it's completed care with understanding and the ability to further their care on with the medications as well. So that's a barrier that we would have to think of. What do we do? Do we get an interpreter? Do we use the language line? And how do we overcome this barrier for the sake of their mental health? So, what can we do as mental health providers to create a trusting environment for our patients that have different cultural diversities or different ethnicities? We can start with education for ourselves. Educate ourselves on our community. And there's no way to know about every cultural diversity, every ethnicity, but you can know about what's in your community. Take the time out to recognize what their coping mechanisms are, what their strengths are, how do you make them feel comfortable, and use best practice and best opportunities to create that trusting environment for them. Find support groups for your community. Find support groups for the different diversities of your community, the different ethnicities. Like for my community, there's a strong Filipino presence, so there are some Filipino groups that talk about mental illness, that talk about other things that affect people just coming from the Philippines into a new environment in the United States. When explaining next steps, make sure they understand. In some cultures, like Asian cultures, they will nod their head yes as if they understand and not understand one word that you've said. Seek translating services if needed and ask for repeat back instructions. What did I just say to you so we can understand? And that way you can tackle what they do know and what they don't know. Emphasize privacy and confidentiality. If someone is concerned that their privacy or confidentiality will be breached or that their community may find out, emphasize in the beginning before the conversations start that this is a trusting environment, that you're in a safe place, and this is how we maintain that safety. Explain that mental health issues are not a sign that someone is abnormal. Educate, educate, educate. Take away the stigma that is placed on mental health, that it is a cyst or a diagnosis of being crazy. Make sure that they understand that this is something that is going on, that we're going to work together to rectify so that you can feel better about yourself and your environment. Keep that education going. Education is the key for us to be successful as well as for the success of your patients. Thank you for listening, and I hope you have a pleasant day.